technical question. Will I just be able to share my PowerPoint from here, or am I supposed to send it to somebody?
Natasha, you can just take over the presentation and share.
Perfect, thank you. This is my first official public Teams meeting. I've done lots of internal meetings, but not a.
Okay, Desiree, I'll wait for you to let me know when the recording's been started. It's 10, so I think we could get going anytime after now.
The recording is started.
Okay, great. I'll go ahead and call this Health Policy Committee to order. Ms. Camacho, could you go ahead and do the roll, please?
Yes. Miss Allard. Miss Allard did enter in the chat that she's here. Mr. Constant.
Here.
Mr. Dunbar.
Here.
Mr. Rivera.
Present.
Miss Zalatel.
Here.
Miss LaFrance.
Here.
And Miss Quinn Davidson.
Here.
Everyone's here.
Great. Thanks everyone for joining. Before we get started, I just want to remind everyone that if you have a question, just go ahead and put it in the chat, or you can text me too. Chat's probably easier because I'm staring right at it. And then just a reminder that anything in the chat is not viewable to the public, so let's try to keep that just technical things, and otherwise everything vocal. Okay, we'll go ahead and start with our first item on the agenda, which is an update from Natasha Pineda on the health department. Natasha, go ahead.
Okay, I'm gonna share my screen. Can you guys see that? Sorry.
Yep.
Yes?
Great.
Okay, great. So first, I'm just going to do a overview for the department, and I thought I'd add this org chart just for people who are new or aren't familiar with how we're structured. It might just be helpful. So while I'm talking, this is what's up, so that you can kind of see how we're organized and what sections and divisions we have. We have not produced any new policy recommendations. We've been unable to attend to that area right now. The 3 code revision areas that we still want to get updates on are the same as they were that we reported in March, related to unfinished animal control codes, childcare licensing, and then cemetery code. The PAO has been super busy, and we have some slides later on during the COVID portion, which I'll share with you some of the work we've been doing, although I think you're very familiar with it probably already. The cemetery is open for the summer burial season today, with a successful test site, basically identifying whether or not things were frozen. So they are going to begin probably about 2 to 3 burials a day for the next few months. They'll be very busy. They brought on a cemetery assistant for the summer, which they do every summer, to help through the big periods of busyness at the cemetery, including Memorial Day, which is coming up. So they'll be working on making sure social distancing and all of the proper procedures are followed in that environment, but also allow people to visit. In the Division of Administration, we have admin support, fiscal, and emergency preparedness and safety. We have been able to transfer successfully to using DocuSign. I know it sounds ridiculous, but it took about 2 years. I've been here for almost 2 years. It took us quite a while to get to an electronic routing method, and we are there. It is very exciting and timely for the pandemic, creating us an opportunity for us to have less of a disruption to our workflow. We have completed several state and federal pass-through grants to the state. We completed the ADRs, the Aging and Disability Resource Center, our HIV/AIDS prevention funding, the Supplemental Nutrition Assistance Program, the Childcare Licensing Grant, the WIC grant, and our public health emergency and public health nursing grants are all actually routing for, those two are routing for approval. But everything has been able to get done in a fairly timely manner. So thanks to everyone on our team. So we should have undisrupted funding, at least for the next year. Animal control, their request for proposal for the animal control contract for FY 2012 to 2025 is at purchasing for review and release. That actually doesn't sound right. It shouldn't be 2012. It must be 2020. The animal warm drop-off kennels and main facilities continue to be closed at animal control, but adoptions and claims are being processed by appointment. The April Animal Control Advisory Board meeting was held electronically or on a video platform, and the May meeting will be held via WebEx. So we're slowly getting all of our boards and commissions up to using a WebEx platform, I believe. Emergency preparedness, I'll talk a little bit about what they've been doing since we saw you last in March, but obviously they're very engaged. Outside of having to have completed their grant application, they've been very busy at the Emergency Operations Center since we last spoke. Human Services Division, that is a division that has childcare licensing, community safety and development, and senior services and emergency outreach. After a brief period of uncertainty for about 30 days, there was a period where we believe from communication from the state that they were going to cut our 30-year grant to basically absorb that at the state level. We did work with them to continue to exercise our delegated authority and funding through at least the next year. Over the last month, they have continued to conduct inspections, complaint investigations at licensed facilities. They have stopped regularly scheduled inspections, but they do continue to go out for any health and safety concerns, calls, or complaints. They've issued 5 renewal licenses, and they have made 4 modifications to licenses for provider requests to continue services during COVID. They have multiple staff assigned to the Anchorage Health Department's operations and the Emergency Operations Center at the MOA. There's a lot going on here. The Community Safety and Development Program completed the substantial amendment public comment for 2018 and 2019 changes, so that should be coming to all of you soon. There is just a lot of dollars that were being put out for a couple different programs, including Habitat to Humanity, Cook Inlet Housing, and then some housing trust funds. So you'll see that coming to the Assembly for review. They did conduct their public hearing for their CAPER, or also called the Consolidated Annual Performance and Evaluation Report. They've also moved to electronic means of public hearings and public comments. So that has been a successful transition for them. Emergency and resource centers, so that includes the Senior Emergency Services and Outreach. The ADRC has continued to receive about 20 to 30 calls a day since we moved to teleservices on March 23rd. They have conducted 57 person-centered intakes, 64 clients received options counseling, 22 households received utility assistance. They get 30 to 50 inquiries a day regarding ESG and utility assistance. 4 houses received $7,500 in rental assistance funds to avoid evictions through the emergency services grants in that program. They, along with 211, continue to have really lengthy conversations with people. A lot of the callers want a lot more time. So our ADRC staff continue to work closely with 211 and make sure that as they refer people, they're all doing coordinated referrals. Emergency Family Shelter Network had some changes in mid-March. Due to the COVID-19 response, volunteers themselves, being mostly elderly, decided it was too dangerous for them to continue that service. So as you've probably heard from reports from the mayor and the Emergency Operations Center, the Emergency Operations Center stood up a block of hotel rooms for families, where they have steadily seen up to 30 families on a daily basis, and the Salvation Army has coordinated to keep those families housed during this period of time. Anchorage Safety Patrol has continued to be very busy in addition to the work that they're doing. The regular sleep-off center facility work, they have
Natasha?
also. Oh, go ahead.
Yeah, Mr. Weddleton has a question. Go ahead, Mr. Weddleton.
Okay.
Sorry, I missed how many people got rent assistance? You said I just missed it.
Oh, sure. 22 households received $6,100 in utility assistance, and 4 households received $7,500 in rental assistance funds to avoid eviction through our existing emergency solutions grant. But they do get up to 30 to 50 inquiries a day.
Well, so how come only 4 got assistance?
I don't have the details for that, and I can see if Nicole is on, but I can find out. Most likely it has to do with the fund source is Emergency Solutions Grant, which is a federally funded HUD program. And typically they have really strict restrictions on who is eligible and allowed to get funds. And it's there's just more restrictions to that funding source than, say, some other funding sources that have less restrictions.
Like the $1 million we did last night.
Yeah, you'll have a lot more people that should be able to be eligible for that if you're not applying these same rules.
Okay, good. Thank you.
But I can get more information for you, John.
No, that's good. I just wondered how it compared with,
Yeah.
what we'll be doing. Thanks.
Thanks, Mr. Weddleton. Any other questions while we have a break? No? Okay, go ahead, Ms. Pineda.
Let's see, where was I? Okay. Anchorage Safety Patrol continues sleep-off center services, but they've also been fulfilling a provider role for isolation and quarantine center. One thing to note is that around March 18th, I was trying to look for the exact date, the Beans contract and any ancillary or secondary services that Securitas was providing became contract managed by the Emergency Operations Center. So I have some information, but not all the information because I am not primarily responsible for the funding source at this time. But if you have any questions about what they've been doing, I'm sure we can follow up and find out. Community health nursing has been incredibly busy. We continue to provide regular services by appointment only. So we're continuing to monitor tuberculosis. We've had some new cases and group cases in the last month of that. We continue to provide reproductive health appointments, which are basically sexually transmitted infection treatment and those kinds of services in the interim, but it's by appointment only. Since we last met on March 4th with you, the community health nursing team has monitored over 691 total cases and contacts. And as of yesterday, they were monitoring 186 cases and contacts, with 135 of those being contacts and 51 being cases. As we go into the presentation on COVID, I'll have a little bit more information to share with you. Environmental Health Services has also continued to be very busy. They have 4 of their staff working full-time at the emergency operations since March. They continue to respond to noise, restaurant, and air quality complaints. They have continued to work on plan reviews as well as liquor license reviews. They did 18 inspections in April based on concerns or complaints. And while they're not doing routine inspections at this time, they're putting a plan together to begin starting that again very soon. They've actually done virtual inspections for a couple of entities, which has been an interesting new way of doing business. The WIC program has been operating remotely via a waiver that was granted from the USDA. That waiver goes through May 31st. The program has gone through waves of increased demand, and we believe that there are more residents in Anchorage that are eligible for the WIC services but are not enrolling. So we're going to continue to be pushing out information to encourage eligible community members to communicate with us and find out if they're eligible for services. They do have 3 vacancies currently in that program, and they've been able to continue operating by borrowing staff from another part of our department. So they have just been working really hard across the across our system to continue to provide and operate services during this period of change. Yep, that's the end of my report.
Oh, great. Can I ask a question about WIC?
Yeah.
So does that money mostly flow from the state that supports those program or that program, or do we also fund it as well?
No, the WIC program is almost entirely funded by a pass-through grant from the state. So it's federal funds that come to the state and then come to us. Last fall, you guys approved a budget that included a small amount of wages for the manager so that we could have her work on other things. But that is there's a very small contribution from the local government.
Got it. Thank you.
No problem.
Any other questions before we move on to the next part of the agenda? Doesn't look like it. Thanks for that comprehensive update. Okay, so we'll go ahead and move on to the COVID-19 update, also from Natasha Pineda.
All right, so when we left you last on March 4th, a lot has happened. For those of you who weren't there in March 4th, I'll resend out the PowerPoint when I send out this PowerPoint. But basically, our department became involved in activities right around January 24th, 25th, when there was a repatriation flight, and our nurses participated in the screening of the U.S. citizens that were returning from China. And since that point, we had a pretty active department operations center. Between the time we met with you and then now, we dismantled our department operations center, and everything got centralized over in the emergency operations center. But I just wanted to remind everybody of the timeline. So March 12th is really the day we had the first case announced as positive. It was also the same day that the municipal emergency was declared. And then following cascading, a lot of changes occurred, right? Closure of libraries, dining and entertainment halted. We moved to remote work for MOA staff. And then we also started working to preserve PPE, but most importantly, not most importantly, but very importantly, on March 21st, the Sullivan and Ben Boki shelters opened up, and that was a really huge move. So it took, I believe the very first meeting with the shelter providers was on March 10th. I didn't put all this detail in here just because it would be too much. On March 11th, the shelter providers and our department and others met with the mayor. And 10 days later, we were able to, the EOC made Herculean moves to get the Sullivan and Ben Boki arena stood up with 6-foot spacing, which has just been really critical to preserving health within that population. Also, kind of unprecedented to complete that in such short time. So thanks to all of the partners and people who made that happen. Then the hunker down started on the 22nd. March 28th, we passed 50 cases in Anchorage. March 29th, the alternative care site was established at the University of Anchorage. On April 10th, Dempsey Anderson isolation started to become utilized. And quickly demonstrated its benefit to the public when we were able to have successfully isolated a traveling individual who wanted to use homeless services. So it's really been a great learning opportunity to see that the way we set it up was a success. So congrats to everyone who worked on that. Continued the hunker down. We are now, moving into phase 1 of easing the Safe Anchorage plan that started on April 27th. And as of today, we're looking at phase 2 for the next phase. We're looking at data, but we're also starting to look at recovery planning for how we expand our own services at the department while also maintaining the ability to respond when necessary. So one of the main things that one of our key things that we did, I think a lot of you have seen, and I wanted to just go through these briefly. I won't spend too much time on them, but I think our early health communication from the health department, we think it was a success. We certainly had rapid growth of our online reach in multiple different platforms. And our PIO, working with others, created some pretty cool graphic series promoting prevention that reached a lot of people in our community. You probably have seen a lot of these things. One of our favorite graphic video adaptations was voiced over by Jack Frost, which was a nice one. So we continued to work on that community messaging. Oops, sorry. Okay, I'm sure you guys have heard that. If not, I can play it later. Then we moved into really trying to promote physical distancing through our visual communication. We think it was effective and successful. It had like a large reach of folks. We were able to help the EOC with messaging as they moved on actions to preserve PPE. And we also found some fun ways to encourage people to stay home. This is an interesting image because when we were working on trying to better understand if we were reaching communities that weren't necessarily English as a first language or refugee populations, we learned that a lot of people didn't actually understand the context of what this message was sharing, because it's contextually, you would really have to understand the nursery rhyme to get the little piggies, stayed home. But universally, everybody understood that the baby is safe if the baby is at home. So we did get some good health messaging education from our diverse communities. So it helped us, I think, in the future messaging that we build for thinking about how images need to be universal. So anyways, we've had a good learning experience. You probably saw as we moved into trying to support healthy activity on trails, but also thoughtful activity on trails. And then we moved into some of our other, grocery shopping and other kinds of messages to try to increase community knowledge about what to do and what not to do. So we also were able to make outreach materials available in up to 10 languages, and we have those all hosted on a website. We continue to work with our communities that do not have English as a first language and looking for creative ways to make sure that everyone's hearing the message, not just the 30% of people in the population who may be targeted by our message, if that makes any sense. So people who live in large congregate housing, frontline workers that may not be able to work from a distance location, those kinds of groups. So we'll continue to work on our messaging. We'll continue to promote the work that we're doing through appropriate venues. So hopefully some of you have seen some of the work of the partnership between the school district and our public health nurses to do contact investigation and tracing. Do you guys have any questions about messaging before I move to partnership working with the state?
I don't see any questions. Oh, go ahead. Did someone, sorry, I thought I heard a voice. I just wanted to say great job, Natasha. I mean, I was seeing all of those things pop up on Facebook. I thought the design was clean and clear and easy to understand, and you guys have just done a terrific job.
Yeah, Barry Pizer's our PIO, and he really jumped in and created some great tools for people. So thank you. Hopefully, I think he might be on, so he probably heard you. He did a really good job with those tools. Let's see. All right, I'll go ahead and move forward, and I'm sure. Oh,
Mr. Weddleton has a comment.
There's a lot of confusion on masks. You see debate. People say, oh, they told us they won't help, so why are you wearing them? And now we think, oh, you should wear them. And I think the notion that mine helps you and yours helps me isn't out there in the public very well. Not probably it is out there quite a lot, but there's a strong minority that simply makes their head explode. Have you dealt with that?
absolutely. Yes. We've even had some interesting people that are like vulnerable populations that don't want to have to wear them, but want to be able to go out and not be worried. So it's an interesting and complex issue, and it's evolved, I think, since over the whole pandemic, but it's helpful for us to know that that's still an area that needs to be focused on. We get caught up in the day-to-day work sometimes, and so we're all wearing masks. So of course we think everyone's wearing, we're spending all our time. I'm here at the health department, spending all my time in a mask, and so is everyone else here. So it's a good reminder, and we'll work on kind of pushing out more language about that, because I have seen in the public a lot, there seems to be a real desire to stop wearing masks, that it's some which is going to be problematic in the long run. So it'd be great if everybody would wear them, but recognizing people have the right not to. There's a lot of businesses that are opting to add it as a requirement on their own, and so we may be looking at whether or not we can create a map for people to see where they can go, where businesses are supporting universal masking of both employees and the public.
Well, Natasha, I mean, retail to be open, it has to require both customers and staff to wear them.
Yes.
So it's not a right to not wear them, sort of. I mean, if you want to shop, you wear a mask.
Right.
I'm not opposed to that. If that weren't required, I would require it in my store anyway.
Yeah, and I think there's a lot of places in the country that it's not necessarily required, but large businesses are going to start making it required nationally. So it'll just be interesting to watch it evolve. But yeah, it is confusing, especially since they encouraged us not to do it. CDC and national voices were saying not to do it in the beginning. But again, I think this is a brand new disease. It's not a disease we met before. It's different than, and it's evolved over time. And so things have changed and recommendations have changed as we learn more about how to prevent it, how we can have normalcy in our lives, and what kind of tools we can use to achieve that. Because I think everybody would like to be as close to normal as possible. And if that requires us to wear masks, then, my kids have to wear them on their butt wherever they're going. So, but we'll keep pushing it out. Thank you.
Thanks.
I wanted to just give you guys a brief overview of, I know you've heard in the news a lot that, or in our press conferences or different things we say, or the governor's team says, we're all working together. And I thought I'd give you some context to what that actually means. So I just looked at just last week, and I thought I'll just tick through kinds of ways that we're working as a department, and also in general, Jason and Chris Judy are involved in some of these conversations. There's a variety of different folks that are involved in different meetings, but we have twice weekly meetings that are set between, there's 3 of us from the city, and then the Ann Zink, Dr. Zink, and then Commissioner Crum. And we have a regular check-in where we review documents. We talk about where are they at, what are we thinking. So we have a kind of a conference that's typically followed up and preceded by multiple emails and document reviews. So we're working really hard to be in as synchronistic as possible. And that's been really a great addition to our process. Once a week, we have a meeting with Dr. Zink, her EPI team, and my data folks. So my our health department medical officer, and some of our staff, who we all confer notes on what their data is saying at the statewide level, what our data is saying at the local level. Sometimes that's different. We talk about variations and what we're seeing in cases, all those kinds of things. So that's once a week. Once a week, we'll also have a regular stand-up meeting with public health nursing related specifically to contact investigation and tracing. So Terry O'Connor, who works at the state, who used to work here at the Anchorage Health Department, she's the lead for the state on making sure that contact tracing investigation, all the tools, resources, and support exist for all of that to continue to happen if we do have an uptick in cases. So we will continue to meet with them every week, even if there's not an uptick in cases, because we're trying to refine our process. As needed throughout this process, we've had meetings with the governor and his team, and our team. I'm pretty positive the mayor has shared that stuff with you. And in addition, we have daily calls, emails, texts, smoke signals between many people from the health department to at the local level to the state health department. when there's a discrepancy in a document, our team will work with their team. Different parts of teams are always working together to make sure that the information is clear and makes sense. And so for the most part, unless there's a mistake, we're generally trying to catch those and share them with each other, and problem solve between the two administrations. And it's been a lot of work, but it's been fruitful. So at the local level, there's continued partnership and engagement with the healthcare partners. We have two working groups, and there's a health metrics work group and then the testing strategy work group. Both of those are made up with local healthcare partners, and they also have folks from the state that participate on them so that we have continuity, because of course the state also has those working groups. But it's important for us to represent what we want at the local level. We've also engaged with UAA to help us with epidemiology modeling and technical expertise. The health department doesn't have a lot of that expertise. We don't have a staff epidemiologist or some of those experts that could fill in and take on roles. So I've been doing that along with some other folks, and now we'll have UAA to help us a little with that, which will be very important going forward. Those are the kind of high level partnerships. Obviously, there's a lot going on, but I wanted to give you guys just a sense of who we're working with and how. So when we talk about healthcare partners, I mean ANTHC, Providence, the Neighborhood Health Center, Regional Hospital, the Hospitalist Group, the UAA folks, the Mayor's Office, the Emergency Operations Center, the Health Department. We also have the Arctic Investigations Center, which is CDC entity that is up here that is actively involved. We have local provider groups. So, oh my gosh, Medical Park has participated in some of these groups as well. So that's just a flavor of who we're working with and engaging with. So I'll talk a little bit about metrics. You have all seen the 3 high-level metrics that we're looking at. The state has 4. Basically, we have the same general areas that we're looking at. It's just that we included testing capacity in our healthcare capacity as opposed to pulling it out as its own item. But we had agreed that that was, fine for us to have, some customization in how we look at things. So unfortunately, I can't see my notes, so I'm just gonna have to wing it. We have, under epidemiology, there's case trends and hospitalization trends, but we also look at % positive tests. There's a variety of different factors that we look at for each one of these metrics. But we also wanted to create something that was as transparent as possible so that as we move forward, we could share with the public. Epidemiology is sometimes not super user-friendly. So you'll see that there's more than just those 2 items that we look at, but those are the ones that we could put together in a dashboard way that'll be easy for the public to understand and interpret. Healthcare capacity is really about whether or not we can manage case surge and whether or not there's enough PPE and testing equipment. And then public health is really about the health department's functionality and our capability of actually being able to interview all cases, track all contacts, and make sure symptomatic cases get tested. So this is just a high level. It's kind of crude, but it was something that we could kind of easily come up with the tools that we have. That'll be, I think it's actually available on the public facing website now. It puts all of these into a place where everyone can see where we are in real time on these issues. So for all 3 metrics, there's these subcategories and where we are. These are just drafts, but I wanted to share with you what the drill downs will be available. We're just not finished with them yet, but we'll get to a point where the drill downs that live, so the stuff that lives behind these green lights and yellow lights is really all mapped out in these nice graphs and charts that give you the detailed information. And so that's coming soon. It's just, we're trying to make sure that it's all correct and reviewed and have all of our quality QA quality process reviewed. The one at the top is a higher level dashboard that looks at all 3 or 4 of each of the factors for each metric. And then this one down here that says results wait time 3 days is a drill down into test results. So that's showing like how long do you have to wait for your test results? What's the percent positive? Because it's really important that we stay under 10%. What is the cumulative number of tests? How many new results are we getting every day? So more, just like more of a drill down. So that's more to come. You'll see coming in the future. The rhythm that we have established pretty much in the last week related to how we're going to share data is going to look something like this. Could change a little bit, but on Thursdays we meet. Oh, go ahead.
Before you get started on that, Mr. Weddleton had a question.
Sure.
Mr. Weddleton, you might be on mute.
I was on mute. Thank you. Just to back up on what you're talking about now with the detailed information on those green dots, that is hugely valuable to people. You know, when your business is closed down and it's just you're so desperate, give me something. Where's the finish line? And people don't know where that finish line is at all in those numbers, and it creates that huge anxiety. And I think people would feel a lot better if they could see, okay, this is the number. How close are we? And have something to hang to. So that's tremendously valuable. I'm glad to see you're working on that. And this may be out of timing for your presentation here, but we've gotten, there are a lot of businesses that are still closed down. They're saying, but look, we can operate safely, and here's how we would do it. And in particular, the O'Malley Center has been really lobbying and has sent us a fairly detailed presentation on how they would operate. And I would say, who would review that and say, yeah, that is good, let them open? I mean, where does that kind of thing fit in?
Well, at this point, it typically comes to Chris Judy first. I mean, it could come to any of us, and then we're going to send it to Chris. I don't know if I can't see my team stuff because this is up, so I don't know if he's on. But the way it works is it comes to him or us, and then there's a group of us that look at it and review it, and then we look at what kind of business is it, where does it fit into the timeline, is it non-essential, public facing, and this, we kind of triage each one because we get them a lot too. So I would just suggest, like, for that one, if it hasn't made it to Chris, send it to him or us or myself and Jason, and we'll put it into the review process. And so that's really how it's been. We've got lots of businesses and industry that have actually sent us their recommendations for how they could open safely, and that has been instrumental in helping us respond quickly and make sure that we incorporate it. And then those things come up, and then we actually talk with our state partners. So we're on our call and we say, okay, where does this kind of business fit into what you're thinking? What phase where is that going to open from the state level, so that we can get alignment there, and then communicate to the businesses themselves so that they know. And that's kind of a long answer, but that's what we do.
Thanks.
Thank you, Mr. Weddleton. I think Ms. Allard had a comment to follow up with that. Ms. Allard? I'll go ahead and read the comment she put in the chat. Oh, she has no volume, she said. So she put in the chat that if they open O'Malley Sports Center, I'm trying to make some, okay. Basically, if they open O'Malley Sports Center, then we also need to open other facilities like the MAC Center in Eagle River. Just a comment.
Yeah.
Go ahead, Ms. Nada.
Yeah, since Chris isn't on, I suspect those are both on our radar. It's just that we have to divide up the work. So agreed. Okay, so just to wrap up this, basically this, I call it the Brady Bunch grid, is available now to the public. It's just an easy to read. We're in a good space right now. these drill downs will become available as soon as any kinks are worked out, but it'll be for those people who are really looking for more detail and also want to see where we're headed, right? And you could do that on a daily basis. So then the rhythm is right now, Thursdays we meet with the State of Alaska data teams. On Thursday afternoon, go ahead.
Before you get going, Mr. Constant has a question.
Sure.
Yeah, it's not a question, more of a comment to the body. You know, this sports center out, the AT&T Center, whatever they're calling themselves now. The one thing that they did that we should be recommending to, I think, every one of the people who runs a business that approaches us is ask them to draft up what they think is a reasonable plan and share that with us. Because while I think the department is going to work really hard to come up with standards for opening, the best people to make those decisions and determinations are the businesses. And if we don't have a template and they send us a template, then we can base our plans on the best of their knowledge, based kind of cross-referenced with the best of the health information we have. And so while I believe Ms. Allard's point about if you're going to do it for one, you got to do it for all is absolutely true, or all within a certain class. Those who are in business, as much as we can ask them to tell us how they would do it, better, because then that just gives everyone more information to work with.
Yeah, and that's how it's been working up until now. So as businesses have ideas and thoughts about how they want to open, they should be getting in touch with Chris Schutte.
Thank you, Ms. Pineda. I have a question or comment from Ms. Allard.
Oh, I think her volume isn't working. Let's see what the comment
Yeah,
is.
she didn't type it in. She called in so that she could ask something.
Great.
Are you there, Jamie? Okay, if you can hear me, Ms. Allard, feel free to type it in and I can ask it for you. But in the meantime, I guess, Ms. Pineda, go ahead.
Longer muted. Am I in?
Sarah, yeah, you're here. Go ahead.
Okay, excellent. So the reason I brought that up, thank you, Chris, is because when I was responding to the emails in regard to the O'Malley Sports Center opening up, I said absolutely. And I also let that person know I'm also in favor of the other greater part of our businesses and other installations and things opening up as well. And when she shot back her email to me, this particular individual, at that point, then she designated herself, I'm a doctor, and now I'm worried that you want other facilities opened up. That was upsetting to me. And the reason why was because she wants the sports center opened up for her own personal gain as far as her kids, ice hockey and ice skating. I get it. I have alpine skiers and children who want to be out there and do it. But my point is that we have to look at it even Steven across the board. And it's not really one or the other. Like all these people want everything opened up. And that's what you're getting inundated with the sports center opening up, but only that sports center. And that's just not okay. And I think we need to understand that. And, you know, I feel the same with churches. I feel churches should be open too. So that's why I said, you know, if you're going to open up one, we need to look at a game plan of opening up the others and other communities, because everybody wants to go back to life the way it was. So thank you. That's all.
Thanks, Ms. Allard. Does anyone else have any comments or questions for Ms. Pineda before she goes forward in her presentation? Okay, looks like we're good. Natasha, go ahead.
Okay, so every week, I believe you guys have started to get your Sunday report from the mayor's office. So that is a result of a kind of a process. So we meet with the state on Thursdays on their data team. That started last week. Then that same afternoon, we have a local meeting, so an Anchorage-based EPI and data meeting. Then Friday morning, we present any updates and review the dashboard with the mayor and the incident commander. And then if we need to update the traffic light dashboard, we would do so if something had changed. And then all of that gets written up, and any adjustments, changes, or notes that needs to be shared are then put into the report to the assembly. So that is kind of finally gelled now. And this week will be our first kind of official run through of all the parts of that. So we hope.
Natasha, before you move to the next slide, Mr. Constant has a question about the report.
Yep, I thank you, Natasha. So the report's been really helpful the last 3 weeks. And this week there was one line that was dedicated to what are we looking forward to? What can you expect in the next week? And I was hoping you might carry back a message that would be a helpful kind of final chapter to that report would be kind of this is where your eyes should be over the next 7 days so that we can be attuned, because all the dashboard information is kind of over the last week, over the last 2 months. And so just, I think it would be helpful to add one little tiny section to the report, and that would be going forward, this is what we're going to be.
Yeah, I'll pass that on and I'll see. Obviously, we are surprised every day.
Right.
Sometimes it's hard to know what's going to happen. I think we can definitely project things that we think you should be watching for, or things to know that we're going to be working on.
Exactly. Not looking for the big
that, but yeah. Sometimes things really do happen and we don't expect them to have happened, or we didn't plan that was something we were going to do, but it happened anyway. So this has been an interesting experience.
Thank you.
No problem.
Thanks, Mr. Constant. And when Suzanne and I met with Natasha, we gave that same feedback, that we felt that it would be really helpful for members if there was a little part about what's next. You know, in the next week or two, if these trends continue, we'll be opening to 50% or whatever the plan might be. So anyway, thank you.
Madam Chair, even if I might, just not so specific like that, but just like these are the areas of consideration that are the better area for you to put your attention to this week, or we're going to be moving off of this. I don't know exactly, but the 50% are these specifics. I think they'll tell us when they have them, but I would even be happy with a less specific level of kind of direction than those things. Those things would be great when we have them, and just as best as possible, some framing of the next section of time.
Okay, any other comments? It looks like she's done with her report. Mr. Dunbar, he has a question.
Thank you, Madam Chair. Ms. Mineta, I was wondering, and I had to step out for a quick minute in the middle there, so I apologize if you said this and I missed it. The plan for the summer, as more air travel starts to come into Alaska and into Anchorage, and I know it's a state airport, but do we have any plan for what is the state's plan for continued isolation for people coming in, or for testing as people come in? I know other sort of, like New Zealand, for example, they have a very aggressive, I believe, testing plan for people that fly into what is also an isolated place. So I just was curious about that.
I don't have their plan in front of me. I know they've been working on stuff, and that contact tracing and investigation work group at the state level has been talking about different software or tools for catching people or screening people at the airports. I just don't know if they actually finalized anything yet. So I can look into where they are with that and follow up. I can tell you just from personal experience, my husband just traveled to go halibut. He's a halibut fisherman. And it was a pretty rigorous process, and he got quarantined on his boat. He was like hustled from an airport to his vessel. They have a quarantine flag on their boat. They aren't even allowed to get off onto the wood deck. It's pretty locked down in the fishery, at least the one he's working in right now. But that's just anecdotal.
Can I follow up on that, Madam Chair?
Yeah, of course.
So the reason I was thinking about it, going back to the hockey thing, and I have to say, I mean, contrary to what Ms. Allard said, I don't want us to start opening large facilities and having large gatherings anytime soon. But I was having a conversation with a hockey parent last night, because they are reaching out to us pretty aggressively. And this parent was talking about a hockey camp that was going to happen, I believe, in July. I could be mistaken about the exact time, but they were still planning on having it. They were have all these kids fly up from the lower 48 and come in to town, and then they were going to do a hockey camp. And so I said, well, what about the 14-day isolation? And they were like, well, we don't think it'll be in effect, or we think we'll just have all the kids together, like hiking or something like that. So we don't think it'll disrupt the camp. I mean, how do you feel about something like that?
There'll be pretty specific guidance coming out about overnight camps and camps, but I'll add the nature of that camp to the list to share with the state, so that it's cared for in the guidance that comes out.
Okay. And I mean, if we can do it safely, great. I mean, I think what they said is, well, we thought that they were going to be tested at the airport and then tested again after 5 days, and that would make sure our kids were safe. And I said, well, I don't know if we have that number of tests, and I don't know what kind of testing program there is. I mean, is there that kind of testing program planned? Do you know? I guess you already said you weren't sure.
I don't know for the camps. I know there has been some significant planning around fisheries
You're
and
thinking
testing.
it's okay to have people come up from the camp, hang out with each other.
What?
Ms. Allard, can you go ahead and get in the queue? I have Ms. LaFrance next, and then I'll follow up with you.
I'm sorry, Ms. Pineda, could you finish that thought?
I know that they have pretty significant testing plans in place for the fisheries, but I can't speak specifically to the camps. So I'll find out.
Thank you. Thank you, Madam Chair.
Great. Ms. LaFrance?
Thank you, Madam Chair. This is more of a general question. And Ms. Pineda, thank you for the updates and for all the work that your team is doing. I'm really impressed at how you all are able to keep up with your regular programs and duties, as well as respond to the pandemic and act in so many other ways. Are there any gaps right now that you see in your department's function, whether in the day-to-day programs you support or anything else now or in the near future, or even for the remainder of the year? And that could be in terms of staffing or equipment or in any area. Thanks.
Yes, Mrs. LaFrance, through the chair. There's definitely gaps in our functioning. I'm impressed every day that everyone keeps coming to work and doing such a great job. This has been, they're working beyond their scope, working beyond limits in some cases. Things that are significant, just immediate gaps, are our lack of data scientists or databases and software and tools that we should just have as a health department to manage our infectious disease issues. So that's just been a significant gap. We should have a full-time staff epidemiologist that can provide guidance and manage our data in a way that is safe and appropriate. So that's just an immediate issue. I'm working on a proposed, I guess, presentation for the mayor on the gaps that we see just in the structure of this department in terms of its ability and readiness to move forward into the future to provide strong public health services and address the areas of concern that this body and the administration have identified as areas they want support on. For example, one example would be up until March 18th, the management of sheltering all homeless people and providing services was done by a portion of a division manager here at the health department who managed a contract for a couple $100,000. That work has taken a large number of employees at the Emergency Operations Center, much vaster, larger kinds of contracts and resources. So in large order, really, it's just a demonstration that we were being asked to provide a level of service that was impossible under the circumstances with the kind of staffing that we have on hand to be able to address the issue. So we're going to be putting that all together in a proposal and suggesting what's necessary moving forward to provide good public health department services.
Thanks,
Thank you, Ms. Pineda. Thank you, Madam Chair.
Yeah, no follow-ups for you, Ms. LaFrance?
Not now, thanks.
Thank you. And I think Ms. Allard is good. Let me know if you need to get back in the queue, Ms. Allard. Mr. Constant?
Thank you. Hey, Natasha. So this is going to be like wearing two hats for me. I work at Aquila, And we are a statewide behavioral health care provider with residential programs in Southeast and here. And so we've been really very responsive in figuring out how to protect our clients and keep our operations going. And one of the biggest challenges has been securing PPE and in particular cleaning supplies, sanitizers, Clorox wipes, etc. And so we're now in the process of scenario planning. Where do we go from here? And we still haven't been able to get up to the baseline level of these supplies that we need. So the question is in two parts. One, we asked the division for guidance in figuring out how to secure PPE. Like, we've got masks finally, but there are just certain elements that have been hard to find. And their advice was talk to the municipality. And so the first question is the Muni coming up with some kind of a mechanism that's kind of methodical for organizations that are working with vulnerable populations to kind of either bulk purchase or figure out supply methodologies? That's question one. And then the question two, I kind of intimated it at Bill yesterday, is for my part with Aquila, I'm looking at us as having beaten the first wave of this, but the fact that we may face a second wave is not far outside of the realm of reality, especially if kids go back to school and the swamp of the joys of going back to school proves to be true yet again, as it does every year, and viruses just kind of flow. So is the division or the department working on some kind of plans and strategies, communication tools for members of the community and providers of various parties on how to spend the next 3 months, 4 months, not hoarding, but being thoughtful about how to approach the potential of a second wave? Big questions, I know. You don't have to answer.
Oh, no, I just wasn't sure if you were done. Are you? Oh, okay. So two parts. First part is, yes, PPE is a challenge. It's even a challenge for us, and we're a healthcare provider. So there's a reason that part of the stoplight is yellow. The EOC put out a nixle on how to order or request PPE from the EOC if you're unable to get it through your normal channels. Have you guys pursued that? I would recommend that you do.
I didn't see that nixle.
Yeah, I'd suggest you use that process so there is a method to ask for it. But they don't have everything. So for example, we're low on a particular type of mask that we need for providing tuberculosis screening and services. They don't have it either, and our staff can't use a different type of mask. So we're in the same situation of looking at and trying to determine what are we going to do, what is the plan forward, what kind of changes do we have to make to ensure that we're able to continue to do our business. So I don't have a perfect answer for it other than to say that that is an emergency operations center function. I'm not a part of the emergency operations center, so I can't answer whether or not they have what you need, but I'd suggest you follow that procedure. And no, we haven't started any process, although we can recommend to the emergency operations center that they do start thinking about how to communicate to the public about how to start managing and collecting materials. So for example, sometimes you can have more success. Well, you get prioritized if you're a health provider. And then even if you're a health provider, they're still very reluctant to send us stuff. So you have to order it in like small batches of 3 or 5 of an item and see if you can get that through. So there's still, I think, considerable concerns with the supply chain as it relates to PPE. And in addition, I guess I would just add that, our department, about 40% of our whole entire staff are either on emergency operations center work or responding to the public health issues through the nursing program. So we are fully disabled from being able to do a lot of the work that we do. And the fact that we're doing it and able to continue services, I think is just a testament to the people that work here, but isn't necessarily realistic for a long run game.
Thanks, Ms. Pineda. And Ms. Salatel had asked to be in the queue, but she graciously declined since it's 10:58 and we want to allow a little time to finish up the agenda and have public testimony, audience participation rather. Just so all members know, Mr. Rivera is going to be following up with everyone to see if there are additional questions and if we might want to schedule a second meeting to talk through more of these health topics. So your questions will get answered. Just going to quickly move through 4A and B. Mr. Peterson, as co-chair of the legislative committee with me, he and I have been working with the administration and with Mr. Rivera to see if there are any things we can do related to COVID through the legislative committee. I've been in touch with legislator myself, trying to understand the process and how it relates to the CARES Act funding. And I know that the budget items we've been talking about in other committees, and we'll have a rules committee meeting this Friday where we do a bunch of brainstorming about what we might do with that funding. So I'm going to go ahead and move to audience participation. And if audience members can just hold it to a minute, I don't want to run too much into the Public Safety Committee's time. I'll go ahead and just read the numbers. Do we have 503-720-9227 on the line? And would you like to provide testimony? Okay, I'll move on to the next number. I'm going to skip the 343, which is hanging up right now. 907-854-5349. Would you like to participate, please? Okay, I think that's it. I guess then we will end on time. I'll go ahead and adjourn this meeting and see many of you soon in the next Teams meeting. Thanks very much. Bye, Miss Pineda. Thank you so much.
Bye.